Hello and welcome to Hurst. My name is Robin and we are going to talk about gestational diabetes. Are you ready? Now, it resembles type 2. During pregnancy, I want you to think about this. The mother needs 2 to 3 times more insulin than normal, and this is because of that metabolic and all of those hormonal changes during pregnancy that can cause insulin resistance. Now, if the mom has some risk factors, let's talk about those. What if she has obesity, prior to becoming pregnant? What about a family history of diabetes or a previous pregnancy with gestational diabetes? Then we are going to screen her at her very first prenatal visit. She will need to be screened at her very first prenatal visit. And then she will need to be retested 24 to 28 weeks if the first test did not show any gestational diabetes. Now, all moms will be screened from 24 to 28 weeks gestation. Okay, now let's talk about some complications to the baby. Some of the complications to a baby are increased birth weight and hypoglycemia. Can you tell me why the baby would be hypoglycemic? What is the first thing that comes to your mind when that baby is born? Why would they be hypoglycemic? Let's talk about it. After delivery, the infant is no longer exposed to mom's rich glucose blood, right? That's right. They're not exposed to that mom's glucose-rich blood. The infant's pancreas, it has been working overdrive, hasn't it? Yes, it has been in overdrive. So, due to the mom's elevated blood sugar. Now, this usually is going to resolve, the pancreas will usually revert on its own to a reduced normal secretion of insulin, and it usually resolves in just a few days. It is self-limiting. This baby will require, though, some glucose supplements until their blood sugar normalizes, right? Yes. Now, all right, so that's just a quick review of gestational diabetes. I want us to answer a question. My friend Thomas is going to put a question on the screen, okay? Now, I'm going to give you just a few minutes and I want you to chat your answers. When you chat your answers, then we will go over the correct answers and the rationales, okay? Are you ready? Here's your question and I will be back in just a minute. All right, let's see how we did on this question. We're going to read the question. I see some answers coming across. Thank y'all for answering those questions. Let's read it together. A client in the 3rd trimester of pregnancy arrives in the emergency room reporting general illness. The client is noted to have a blood glucose level of 390. Now, your normal range is 80 to 130, right? And they are diagnosed with gestational diabetes. The primary healthcare provider prescribes 30 units of NPH insulin, subcutaneously stat. What is the nurse's priority action? Okay, we have a priority question right here. Are we going to do number 1, administer the dose of insulin immediately? Are we going to question the type of insulin prescribed? Are we going to insert an IV for an insulin infusion? Or are we going to question the dose of the insulin? Let's start with the clues that we have provided, okay, that we've got provided for us in the question. We see that a client is in their 3rd trimester of pregnancy, and they are being treated for gestational diabetes. They've got a blood sugar of what? 390. Now, I want you to recall that an elevated blood sugar, glucose, elevated blood glucose level in pregnancy, y'all, it is going to cause the same vascular damage that occurs with diabetes mellitus, the same damage. Now, the greatest concern is that that erratic blood sugar level contributes to deterioration of the placenta, okay, before the fetus is full term. Therefore, it is crucial right here for us to reduce that glucose level. And we want to do this as quickly as possible, don't we? Absolutely. Now, and then we provide the appropriate daily medications or the insulin, along with teaching this client to help them understand gestational diabetes. We have a teaching role right here, don't we? Now, the question provides the prescriptions written by the primary healthcare provider, and we see that right there for the client. Remember that information in this question, it is there for a reason, isn't it? Yes, look carefully. I want you to look carefully at those prescriptions. Does something in particularly jump out at you? Look at that. I want you to look at that. What do you see that you, as the nurse, should address first? Let's look at number 1. Are you going to administer the dose of insulin immediately? It says sub-Q stat. Are you going to administer that dose of insulin immediately? Are you? Absolutely not. No, you're not going to do that. It is true that this pregnant client does need some treatment right here, right, for that high blood glucose level. However, there is a problem. We have a problem right here with the prescription as written by the primary healthcare provider. The nurse needs to question these prescriptions first. That's what we need to do. Y'all, the NCLEX wants you to question prescriptions to prevent mistakes. So number 1, we are not going to do that. I see some answers coming in, and I see several. Number 2, question the type of insulin prescribed. Well, is that what you're going to do? Wonderful. If you chose that answer, you are absolutely correct. You caught the error. Notice that the client was prescribed NPH insulin. Remember, what is NPH insulin? That's a long-acting insulin, right? Yes, with an onset of about 1 to 1.5 hours. That is too long to wait to start trying to bring down an elevated blood sugar, right? The nurse's first priority should be to question the type of insulin for this client. Now look at number 3. Insert an IV for an insulin infusion. Well, not quite yet. The client will need an IV to continue treatment, won't they? Although there is no mention of a prescription of insulin in this stem of this question, the client will most likely be given some isotonic solution, some isotonic fluids while they're in the emergency room. But y'all, the insertion of an IV right here is not our priority as a nurse, is it? That's not our priority right now. The problem right now is we've got an elevated blood sugar, and our priority is to get that blood sugar down, right? Now look at number 4, question the dose of insulin. Not this one. That's not what we're going to do. You are getting close by considering that the prescription has an error. However, the problem is not with the dose, right? It is with the type of insulin. So your correct answer is option number 2. All right. I'm going to give you just a minute. We're putting another question up on the screen, and I will be right back. Okay, are you ready to see how you did on this question? Let's read it together. A client with gestational diabetes delivers an infant with macrosomia. What is the priority newborn assessment for the nurse to perform? All right, y'all, this is a priority question, so let's look at it. We must find the killer answer, right? Listen, see all of the options that they have listed right here, they may apply to the situation, but you as a nurse, me as a nurse, we must decide which one is most harmful if not done. So we've got to figure out what can we do out of the options they gave us that's going to help our client the most. Let's look at the hints in the question. Macrosomia describes a newborn who is significantly larger than average, right? Macrosomia may complicate vaginal deliveries and could put the baby at risk for injury during birth. So let's think about everything that we do know about this type of delivery. Fetal macrosomia also puts the baby at an increased risk of health problems after birth, such as hypoglycemia. So what is the killer answer right here? If you had to choose out of those four things, what is the killer answer? If you do not do something about it right now, what could kill your client or cause significant harm? Hypoglycemia, right? Check the blood glucose level first, okay? Number 4, monitor blood glucose values. Infants of diabetic mothers are at risk for hypoglycemia following birth. Hypoglycemia can trigger seizures and cognitive deficits. So out of the 4 options they've given us, number 4 is the most important. Now, number 1, assess for cephalhematoma. Listen, assessing for this is important in macrosomia infants, but not as vital as ensuring that glucose level. We need a stable glucose level. Look at number 2, determine if there is a clavicle fracture. Assessing for a clavicle fracture is important with this type of delivery with the macrosomia baby, infant, but it is not our priority, right? That is not our priority as a nurse. Observe for signs of facial palsy. That is important as well, okay? This is also not as important as ensuring a stable glucose level. So your correct option is option number 4. All right, y'all did really well on those. Thank y'all for joining. I want you to come back. Don't forget, we do these often. Follow along with Hurst Review and come back to see us real soon. Bye for now.